Hello, everyone. My name is BELLAMY, and today's topic will be about mental health. 2020 has been a year where a number of traumatic events have occurred, with the most major one being the coronavirus pandemic. For many already struggling with mental health issues, the pandemic has seemed to amplify one's symptoms. According to the Anxiety and Depression Association of America, anxiety disorders are the most common forms of mental illness in the United States, affecting 40 million adults, and approximately 322 million people worldwide currently live with depression. Today, I will be interviewing Kaity Rodriguez, a psychotherapist, confidence educator, and empowerment speaker. Kaity will be discussing how the pandemic has affected mental health and go over useful strategies people can practice and utilize in their everyday lives. Hi, Kaity. Thank you for joining me today.
Hi, CLARETTA. Thanks for having me.
So during the pandemic, a lot of people have been dealing with mental health issues, even before the pandemic. So I wanted to know, what are the common mental health issues that you see your patients dealing with during this time?
Yeah, well, being that I already worked with the anxious population, I'm seeing a big spike in that. Generalized anxiety disorder is a sense of being worried, and your worry being about a number of different things, not just one specific thing, for a significant period of time. So those that were already anxious are now even more anxious because there's a lot of fear and uncertainty and worry around what's going to happen with their health, the health of their loved ones, what's going to happen with the economy, jobs. So there's just a lot of worry. Anything that was there before COVID is just kind of exacerbated times 10 by COVID. People who may have had substance use disorders, we're seeing an increase in that. So more relying on alcohol, marijuana, and different substances to kind of help cope is another thing that we're seeing as well.
And why do you think the pandemic has had such a large effect on people's mental health?
Well, I think for a few reasons. The most obvious one would be the social distancing. We find strength in the group and survival in the group, and so telling everyone to stay away from whether it be loved ones or just socializing. Period. Although we can see each other virtually, like we're doing now, there's nothing like being able to be in the physical presence of people. COVID-19, it is an actual real threat that has taken lives. And so whenever there's an actual real threat and you're hyper focused on it kind of chronically over time, it can create some of the symptoms of post-traumatic stress disorder. So that chronic stress, that chronic worry, and then the loneliness and isolation, I think are what's creating some of the mental health issues that we're looking at now.
What are some of the practical strategies people can implement in their everyday lives?
So whether or not you're symptomatic and having a ton of problems around your mental health or not, you still want to be doing certain things that will help to prevent you from becoming symptomatic. But there are some things that we can do that will boost our oxytocin levels. So oxytocin is the bonding chemical. It helps us to feel good. And some of the things that we can do to boost our oxytocin level, one is to take warm baths. I recommend putting magnesium flakes or Epsom salt in the bath. Magnesium is a mineral, and it helps us to relax. It helps slow down brain activity. So the warm water combined with that magnesium will bring up the oxytocin level and bring down the stress level. Another thing that I love myself, I was doing this before the pandemic, but investing in a weighted blanket. So if you're a person that's a single person or you live by yourself and you like to be hugged, but you're not around anyone, taking a weighted blanket and wrapping it around your shoulders, the weight and having it around your shoulders is going to kind of simulate a hug, and it just helps to feel better. Also, dancing, turning on music and just dancing is going to change your body chemistry. So these are just some small things that you can do to change the way your body is kind of processing what's happening and changing your own body chemicals and hormones to feel better.
There are a lot of people during the pandemic that have lost loved ones or those they have known personally to COVID-19. So what advice do you have for those who are currently grieving?
Well, I definitely say if you find yourself really struggling, to make sure that you reach out to a grief therapist. One thing is to know that over time your pain will transform and you won't feel it in the same way as you feel it now. So picture a box, a square box, and within that box there's a little button, and that button triggers pain, right? So that's the pain, let's say that's the pain of grief, of losing your loved one. And then also in that box there's a ball that's bouncing around in the box. And when your loved one first passes, the ball is huge. So that means that it's constantly hitting that pain button. It's constantly hitting the pain button. But over time, that ball becomes smaller and smaller and smaller. So the grief is still there. We never like to say that, you completely get over or, move past losing a loved one. But the pain becomes smaller and the triggers become smaller to where over time it's only hitting that pain button every once in a while. So just know that as time progresses, your pain will become more manageable.
Do you have any external information or external resources that people can use to help combat their mental health issues?
Sure. So I like to refer people to the Therapy for Black Girls website for minority populations. A lot of times when it comes to the Black community, we want to make sure that whoever we're seeing when it comes to our experience, our mind, our mental health, understands who we are and is relatable. So the Therapy for Black Girls website is a good resource. Another good resource is Open Path Psychotherapy Collective. So that is a directory of therapists that will accept clients for a sliding scale or a low fee. So I like to give that resource to help make therapy more accessible because some people may not have insurance or be able to afford the out-of-pocket fee. So finding someone who will provide low fee services or sliding scale is helpful. We're pretty resilient. That's one thing that I want to make sure people know and understand about this pandemic. Pandemics have happened before. Last one was about 100 years ago with influenza, and it took about 3 years for everyone to not for things to be safe and be normal, but for everyone to feel safe and be back to normal. So we've gone through this before. It's not the end of us. It just feels really scary and really bad when you're in it. But human beings are incredibly resilient, and we learn how to bounce back pretty quickly because we know how to survive.
Well, thank you so much, Kaity, for taking the time to sit with me today. Thank you for your insight and your advice about mental health, and I hope you stay safe and have a great day.
Same to you, Claretta. Thank you so much for having me. Take care.